Reaching 70 is a blessing, but with age comes responsibility towards your body. Small habits can decide whether you stay strong and independent or face unnecessary health troubles. One of the most overlooked yet powerful practices is cleaning three vital body parts every single day. Neglecting them may silently invite disease, discomfort, and even shorten your golden years. Boosting immunity through daily hygiene might seem like a simple practice, yet it carries profound importance, especially after the age of 70, when the body's natural defenses begin to weaken. At this stage of life, the immune system does not respond as swiftly or as strongly to invading bacteria, viruses, or fungi as it once did. This slower response makes older individuals more vulnerable to infections that may appear minor but can quickly escalate into serious health issues. Something as basic as regularly cleaning specific body parts becomes a shield against harmful microorganisms. For example, bacteria thrive in warm, moist areas of the body, and when left unchecked, they can spread silently, causing infections that lead to fever, inflammation, or more severe complications that take longer for the body to fight. By paying attention to daily hygiene, one reduces the bacterial load and decreases the risk of these harmful invaders finding an easy entry point. This simple discipline strengthens the body's first line of defense and keeps immunity functioning at its best level possible. Another reason why this habit is so crucial is that infections in older adults often do not present with the same obvious symptoms as in younger individuals. What may begin as mild discomfort can progress unnoticed until it becomes dangerous. A urinary tract infection, for instance, can quickly spread to the kidneys or bloodstream in someone whose immunity has declined. Similarly, fungal infections in neglected body areas may not seem alarming at first, but they can cause significant irritation, skin breakdown, and even open pathways for more serious infections. Daily cleaning reduces these risks, acting as preventive medicine without the need for pills or complicated routines. It keeps the skin barrier healthy, which is vital since the skin is the body's largest immune organ. When clean and intact, the skin blocks pathogens effectively, but when neglected, it becomes vulnerable to breaches that compromise overall immunity. The act of daily cleaning also supports other aspects of health that indirectly influence immunity. Staying clean reduces stress on the body by minimizing inflammation and irritation. When the body does not have to waste energy constantly fighting off small infections or dealing with unnecessary inflammation, it conserves strength for more important immune functions. Furthermore, cleanliness lowers the risk of hospital visits, which can expose older adults to hospital-acquired infections, an added threat for those with weaker immune defenses. Simply staying consistent with hygiene provides a layer of natural protection that cannot be underestimated. It is also important to recognize that boosting immunity in later life is not just about avoiding illness, but about preserving independence. Each infection or illness that is prevented helps maintain energy, mobility, and freedom in daily life. Recovering from infections often takes much longer in the elderly, draining strength and sometimes leading to lasting decline. By making cleanliness a non-negotiable part of the daily routine, the immune system gets consistent support, ensuring the body is not constantly under attack. This not only extends life, but also improves its quality as it reduces the frequency of illnesses that can rob older individuals of their vitality. In the end, cleaning these critical body parts every day is not merely about looking or feeling fresh. It is a powerful act of self-preservation. It is about giving the immune system every possible advantage when age has already made it more fragile. What seems like a simple routine of hygiene is in reality a quiet but strong defense against invisible enemies that prey on vulnerability. With this small yet powerful step, one can strengthen immunity, prevent infections, and enjoy the later years of life with greater resilience and confidence. Preventing chronic illnesses in older age is often seen as a matter of diet, exercise, and medication, but hygiene plays a surprisingly powerful and often underestimated role. After 70, the body's resilience is not the same as it once was, and the smallest oversight can become the root of a much larger health challenge. Cleaning vital body parts daily is not just about removing dirt or odor, it is about creating an environment where chronic problems have less chance to develop. Neglect in this area can lead to the accumulation of bacteria, fungi, and toxins that slowly weaken the body, setting the stage for persistent conditions that rob individuals of their energy, comfort, and independence. Something as seemingly harmless as failing to wash properly can lead to skin issues like eczema, fungal growth, or persistent rashes, all of which may seem minor but can evolve into long-term health struggles that demand ongoing care and treatment. Chronic urinary problems are another area directly linked to daily hygiene. When personal cleaning is ignored, bacteria can build up and travel into the urinary tract, causing infections that are not only painful but also recurring. These infections can spread and damage the kidneys or create cycles of antibiotic use, which in turn weakens natural resistance and leaves the body more vulnerable to new illnesses. For older adults, such recurring infections can be debilitating, causing fatigue, confusion, and even hospitalizations. Preventing them through consistent cleanliness is far easier and far less risky than dealing with their consequences. Respiratory conditions can also be indirectly linked to hygiene because bacteria and allergens that linger on the body, particularly around the mouth and nasal passages, can be inhaled or transferred, aggravating asthma, chronic bronchitis, or other lung-related conditions that many elderly people already struggle with. Another dimension to this is the way uncleanliness contributes to systemic inflammation. The body recognizes bacteria and fungi as threats, and when these organisms are allowed to flourish unchecked, the immune system remains in a constant state of alert. This ongoing low-level inflammation is now understood to be a key driver of many chronic conditions, including arthritis, heart disease, and even cognitive decline. By keeping the body clean, one is not only removing surface threats, but also reducing the overall inflammatory burden, giving the body more room to maintain balance and focus on healing rather than constant defense. This reduction in chronic inflammation is a quiet but crucial benefit that daily hygiene provides, especially in the later decades of life. Beyond physical prevention, consistent cleanliness fosters routines that reinforce overall health. When daily cleaning becomes non-negotiable, it builds discipline that often extends into other health practices like proper nutrition, medication management, and regular movement. Each of these areas supports chronic disease prevention, but cleanliness remains the foundation. Without it, even the best efforts in other areas can be undermined by the constant intrusion of infections and irritations. By staying clean, older adults reduce the need for frequent doctor visits, lower their dependence on medication, and maintain a level of control over their health that empowers them rather than leaving them at the mercy of preventable problems. Ultimately, preventing chronic illnesses through hygiene is about respecting the body's vulnerabilities while also recognizing its strengths. The body at 70 still has remarkable capacity to heal and thrive, but only when it is supported by practices that minimize unnecessary risks. Daily cleaning of key body parts is one of those simple but profoundly effective acts. It reduces the risk of persistent infections, protects vital systems like the urinary tract and lungs, lowers inflammation, and safeguards against the slow buildup of conditions that can take years off life and diminish the joy of living. It is a quiet yet powerful investment in long-term health, ensuring that the later years are not defined by constant battles with illness, but by freedom, comfort, and vitality. Enhancing mobility and comfort in the later years of life is not only about exercises or medical treatments, but also about maintaining proper hygiene, particularly the regular cleaning of certain body parts that often get overlooked. After the age of 70, the skin becomes thinner, more fragile, and prone to irritation, while the joints and muscles lose some of their flexibility and strength. Even small sources of discomfort, such as itching, rashes, or skin breakdown, can make moving around more painful than it needs to be. Daily cleaning removes sweat, bacteria, and dirt that can accumulate and cause irritation, helping the skin stay smooth and healthy. When the skin feels good, movement feels easier and more natural, which directly contributes to overall mobility and comfort in daily life. Neglecting hygiene, on the other hand, often leads to small irritations that grow into bigger problems, reducing confidence in movement and creating hesitation in doing simple tasks. When hygiene is not prioritized, certain body parts become breeding grounds for infections that can cause swelling, redness, or stiffness. For example, fungal infections between the toes may seem minor, but they can lead to pain with every step, making walking or even standing an uncomfortable experience. Similarly, neglecting cleanliness in areas prone to sweating and friction can result in painful rashes that restrict movement. For an older person, even a small cut or infection can take a long time to heal, and during that period, mobility may be severely limited. Daily cleaning prevents these situations from arising by keeping the skin dry, clean, and free of harmful microorganisms. This not only preserves comfort, but also helps the body remain active and strong, as the ability to move freely is one of the greatest defenses against decline in older age. Comfort is also tied closely to confidence. When the body is well cared for and feels fresh, there is a greater willingness to engage in social activities, take walks, and remain independent. Discomfort from unclean body parts, however, often leads to withdrawal, a preference for sitting still, or a reluctance to go out, which in turn reduces mobility further. This cycle of discomfort leading to inactivity can have lasting consequences for overall health, as muscles and joints stiffen when not used regularly. By maintaining daily hygiene, older individuals break this cycle, staying more comfortable in their bodies and more motivated to keep moving. In addition, the comfort brought by cleanliness extends to sleep and rest. Irritations caused by neglected hygiene can make it difficult to sit or lie down comfortably, leading to poor sleep and restless nights. Lack of proper rest then worsens fatigue and makes movement during the day more difficult. Cleanliness eliminates much of this discomfort, paving the way for more restorative sleep and greater energy, which further enhances mobility and independence. Comfort and mobility work hand in hand, and both are supported by something as simple as daily cleaning. The ability to move without pain or irritation is one of the key markers of quality of life in older age. Every rash prevented, every infection avoided, and every irritation reduced adds to a greater sense of ease in daily activities. Whether it is bending to pick something up, walking around the neighborhood, or enjoying time with family, mobility is freedom, and comfort is the foundation that allows that freedom to continue. Daily cleaning of essential body parts may seem like a small act, but it is one of the most effective ways to protect this freedom. It ensures that the body remains a place of ease rather than discomfort, supporting independence and making the later years not just longer, but far more enjoyable. Supporting mental well-being in the later years of life is as much about physical habits as it is about emotional care, and cleanliness plays a far deeper role in this balance than most people realize. After 70, when the body slows down and the mind often battles loneliness, memory challenges, or feelings of vulnerability, maintaining a routine of daily hygiene provides a powerful sense of dignity and self-respect. When the body is clean, fresh, and comfortable, it creates a natural boost in confidence, and this confidence reflects in the way a person interacts with others and engages with life. Neglecting hygiene, however, often leads to embarrassment, self-consciousness, or withdrawal from social contact, which can heighten feelings of isolation and sadness. By simply keeping the body clean, especially the parts most prone to odor or irritation, one preserves not just physical health, but also a healthy self-image that strengthens mental resilience. The connection between hygiene and emotional health becomes even more important when considering how strongly the mind and body are linked. Discomfort from uncleanliness can easily affect mood. Constant itching, irritation, or even the awareness of not feeling fresh can weigh heavily on one's thoughts, creating frustration or irritability. This subtle stress, repeated day after day, can accumulate and lead to anxiety or even depression. On the other hand, the soothing ritual of daily cleaning not only removes these irritations, but also creates a calming routine that gives structure to the day. Routines provide reassurance and stability in older age, helping reduce uncertainty and stress, which are common triggers of mental distress. The act of taking care of oneself daily communicates an important internal message: I am worthy of care. And this mindset directly nurtures mental strength. Social life also benefits enormously from cleanliness. At an age when companionship and family interactions are vital to emotional well-being, being clean ensures comfort and ease in connecting with others. Poor hygiene often becomes a barrier to these interactions, as individuals may feel hesitant to meet friends, attend gatherings, or even enjoy time with grandchildren due to embarrassment or fear of being judged. Cleanliness, therefore, is not just about self-perception, but also about maintaining social bonds, which are known to protect mental health and add joy to life. When one feels fresh and presentable, there is a natural openness to engaging in conversations, sharing laughter, and participating in community, all of which uplift the spirit and reduce loneliness. Even deeper is the psychological impact of retaining control. After 70, many aspects of life feel less within one's command. Health changes, energy levels decline, and independence can sometimes feel threatened. Daily hygiene, however, remains a personal choice and a simple yet powerful act of self-determination. Each time a person decides to clean their body carefully, they affirm their agency and control over their well-being. This sense of autonomy protects against feelings of helplessness and gives strength to face the challenges of aging with greater courage. Mental health thrives on this sense of control, and it begins with such small but meaningful daily practices. Ultimately, supporting mental well-being through hygiene is about understanding that the mind cannot be separated from the body. When the body feels clean and cared for, the mind feels valued and respected. A person who maintains this discipline is less likely to be weighed down by improving sleep quality in later years is a challenge many people face, as aging naturally brings changes to sleep cycles, often leading to restless nights, frequent awakenings, or difficulty falling asleep. While many look to medications, special diets, or relaxation techniques to improve rest, one of the simplest and most overlooked contributors is daily hygiene. Cleaning essential body parts before bedtime removes dirt, sweat, and bacteria that can cause irritation, itching, or odor, all of which subtly disturb the ability to relax fully. Even minor discomforts like a slight rash or sticky skin can prevent the body from reaching the deep restorative stages of sleep that are so critical after 70. By ensuring cleanliness each day, the body feels fresher, more comfortable, and more ready to rest, creating an environment that naturally supports better sleep. When the skin is free of sweat and impurities, it is less prone to itching, which is one of the common yet unspoken reasons for disrupted sleep in older adults. Small irritations that go unnoticed during the day can become magnified at night when the body is still and the mind is quiet. These disturbances may lead to constant tossing and turning, reducing sleep efficiency and leaving the body fatigued in the morning. Regular hygiene eliminates many of these triggers, calming the skin and allowing for more uninterrupted rest. Sleep is not just about duration, but also about depth, and the absence of irritation helps the body sink into those deeper stages where true healing, repair, and memory processing occur. Another reason hygiene plays a crucial role in sleep is the mental association it creates. Performing a nightly routine of cleaning certain body parts signals to the brain that it is time to wind down. This kind of ritual builds consistency, and the mind begins to link the act of cleansing with the approach of rest. Over time, this routine itself becomes a form of sleep preparation, reducing anxiety and helping the body transition smoothly into slumber. Especially in older age, when sleep cycles are more fragile, such consistent cues can make a significant difference. The body thrives on rhythm, and hygiene offers a simple, practical way to reinforce this natural cycle. Cleanliness also affects temperature regulation, another important factor in quality sleep. Sweat and unwashed skin can trap heat, causing discomfort and overheating during the night. After 70, the body's ability to regulate temperature is not as efficient as before, so even minor imbalances can disturb sleep. Daily cleaning refreshes the skin, unclogs pores, and helps maintain a more balanced body temperature, creating a cooler, calmer environment that supports restful sleep. The feeling of freshness itself contributes to relaxation, as the body feels lighter and more at ease when free from the weight of dirt and residue. The benefits of better sleep reach far beyond the night itself. Restorative sleep strengthens memory, sharpens focus, enhances mood, and supports immune function, all of which are especially vital in older age. Without adequate sleep, the body struggles to repair itself, leaving individuals more prone to illness, fatigue, and emotional instability. Daily hygiene, by improving sleep, indirectly supports all these other areas of health as well. It is not just about feeling clean, but about unlocking the restorative power of sleep that the body depends on to stay strong and resilient. In the end, cleanliness is one of the simplest yet most powerful tools for improving sleep quality after 70. Improving sleep quality in later years is a challenge many people face, as aging naturally brings changes to sleep cycles, often leading to restless nights, frequent awakenings, or difficulty falling asleep. While many look to medications, special diets, or relaxation techniques to improve rest, one of the simplest and most overlooked contributors is daily hygiene. Cleaning essential body parts before bedtime removes dirt, sweat, and bacteria that can cause irritation, itching, or odor, all of which subtly disturb the ability to relax fully. Even minor discomforts like a slight rash or sticky skin can prevent the body from reaching the deep restorative stages of sleep that are so critical after 70. By ensuring cleanliness each day, the body feels fresher, more comfortable, and more ready to rest, creating an environment that naturally supports better sleep. When the skin is free of sweat and impurities, it is less prone to itching, which is one of the common yet unspoken reasons for disrupted sleep in older adults. Small irritations that go unnoticed during the day can become magnified at night when the body is still and the mind is quiet. These disturbances may lead to constant tossing and turning, reducing sleep efficiency and leaving the body fatigued in the morning. Regular hygiene eliminates many of these triggers, calming the skin and allowing for more uninterrupted rest. Sleep is not just about duration, but also about depth, and the absence of irritation helps the body sink into those deeper stages where true healing, repair, and memory processing occur. Another reason hygiene plays a crucial role in sleep is the mental association it creates. Performing a nightly routine of cleaning certain body parts signals to the brain that it is time to wind down. This kind of ritual builds consistency, and the mind begins to link the act of cleansing with the app